Welcome to Health Alert. I'm Pam Butler. Today we're going to talk about nutrition and various health conditions. And joining me is Amy Pulse. She is a registered dietitian with Morton Comprehensive Health Services. Welcome to the show and welcome back.
Thank you.
Now, let us start with looking at basic nutrition before we get into sort of the specialty focus of various health conditions, whether they're acute or chronic. What does normal nutrition look like?
Normal nutrition really looks at what we call epidemiological studies, where we look at what people who are very healthy, that live healthy, long, high-quality lives, what they eat, and then we translate that into recommendations for the general population.
Okay, now when we think about that, of course there are distinctions between children, adults. Are there also distinctions between males and females as children and or adults?
There are some small differences, but overall, actually, we want our children to eat the same way we want adults to eat, just different portions. So that's a hard thing to come across to a lot of parents, that their children actually believe that they have a different diet than their parents do, and they'll tell them that they believe they have different types of yogurt, different types of cereal,
right.
And really, when it comes down to the general recommendations, we want everybody eating the same healthy foods.
Yeah, because that's sort of a marketing ploy, isn't it? Because
It is.
I've seen yogurt for children and different things like that, and of course it costs a little bit more.
Sure.
But is it really the same yogurt?
Generally, kids marketed foods tend to be very high in sugar.
Okay.
So your average Trix yogurt will have 3 or 4 teaspoons of sugar in it, where if you go to the more adult marketed versions of yogurt, you can get very low sugar or no sugar added yogurts.
And those really are healthier.
They are.
Okay.
Yeah.
Let me ask this question. We talked about sort of some minor distinctions between adults and children. Calcium, milk, is that one of those distinctions? And tell me the difference between the different kinds of milk, because we've got low fat and rice and soy and all kinds of things.
The difference for our younger kids, really kids under 5 or 6, the portions are smaller. So we're looking at 4 to 6 ounce portions of milk versus 8 ounce glasses of milk, which we would recommend for our older elementary school kids, adolescents, and then adults. We're really looking for 3 servings per day of milk or dairy or yogurt, but 3 total portions of those. So that really doesn't change a lot after elementary school.
Now, do kids need more calcium than adults, or do adults and kids need the same? Tell me about this in relationship to actually bone development and that type of thing.
Right, so your peak bone mass really doesn't happen until you're 30. So that's why those recommendations don't change a whole lot between the time that you're in 3rd grade to the time that you're 30. We want you to have those 3 servings of dairy. Certainly you can add on supplements into your diet, and those can range anywhere from 800 to 1,200 milligrams per day, depending on your age.
Okay, now
and your risk.
With this vitamin D, is that an important component with the calcium?
It's very important. We are starting early with vitamin D supplementation. So our breastfed babies, we're actually having them start vitamin D supplements very early in infancy, starting with 200 milligrams. And then after that, we're looking at 400 to 600 milligrams as children get older, and adults can go up to 800 milligrams per day.
Now tell me a little bit about, and our viewers, because they may just be saying to themselves, well, what about this vitamin D? Why do you need it in relation to calcium?
We need it more than we did before, and that is has a lot to do with us being inside more than we used to, and so we're finding that our bones are softer because we don't spend the time outside that we used to. So back in certainly in the early part of the century, we saw rickets a lot more than we do now, but we're seeing kind of an upswing of that incidence of rickets, and that has to do with kids being inside more. Maybe parents are limiting dairy because they're concerned about calories, and so the kids are not getting the vitamin D that's associated with milk and cheese and yogurt.
Okay, and that helps us use that calcium more efficiently, so your bones can really use it.
Right, and that certainly happens in adulthood. We stop drinking our milk and start drinking other beverages like pop, and that kind of weans out that access to vitamin D. And then we have jobs where we work all day and we don't go outside.
And that's really critical because with our kids, a lot of times they're in front of the TV, the video games, and they become more sedentary with problems with obesity and all kinds of things.
Sure.
And so it's affecting this area as well.
Yes, yes, absolutely. So overall, general recommendations are a very well-balanced diet where we're getting a variety of the dairy, the proteins, fruits and vegetables, and grains. And when you eat that way, you tend to stay fuller longer. You stretch between your meals, and that helps prevent that obesity. It takes a while for your body to pull apart high-quality foods, and those tend to keep you satisfied longer. So dairy is a wonderful part of that picture of keeping you not only your bones healthy, but making sure that you maintain a healthy body weight.
Okay, and I do want to ask you one other question. You might think I'm stuck on calcium, but
That's okay.
It really is important, I think, especially for kids and as adults with bone development, and you know how you're able to maintain your structure, your spine, and all kinds of things throughout your life. You talked about supplements, like with vitamins, up to 1,200 milligrams. Should you break that up? I've heard that the body can only absorb so much at a time.
Certainly true, and we do see people that take too much at one time. They tend to get constipation or side effects from that. It's always better to take supplements frequently or more often throughout the day than all at once, but it's always better to take it than not at all. So however you can get it in. A lot of my patients just take Tums. That it's an easy thing to carry in their purse. They can chew it up. There's also the Viactive chews that are easy to take, with a meal, and you don't feel like you're swallowing pills all the time.
Okay.
And those are also great options for getting some extra calcium, extra vitamin D, and magnesium in a lot of the supplements as well.
Okay, now tell me about, I do want to focus on this with that back to the milk thing. Whole milk, 2% milk, 1% milk, skim milk. I mean, does anybody need the whole milk, and if so, at what ages, or should
Children under 2 need whole milk, and that is really because the cholesterol and the fats associated with milk are essential for brain development.
Okay.
After 2 years of age, if kids are gaining weight and growing properly, then they can go down to 2% milk, and then after kindergarten, they can do 1% is adequate. Vitamin A and D are probably the largest source of those vitamins come from dairy, and so we like to see a little bit of fat in the milk. Fat-free isn't necessarily beneficial. If you can't absorb fat, you can't absorb those fat-soluble vitamins. So 1% is plenty of fat to absorb those vitamins, and you're getting all the calcium and the protein associated with those.
Well, when should we kind of look at fat-free? Is that when we get past 30 or
Yeah.
in that kind of range?
Yeah, when you become an adult is fine, or even in the teen years.
Okay.
You're fine. Yeah.
You can switch to that.
Yeah.
Now, what
or
about
if
people?
you want to take a supplement, then you don't
Then
have to
you could
worry
do
so much
that.
about it.
Okay.
Yeah.
What about people who are lactose intolerant and they say, I can't do milk?
Well, there's 2 options for them. One of the options is to do the lactose-free or low lactose milk. A lot of the lactate types of milk, or dairies is the other one that I'm familiar with. Those are what we call low lactose. They're 99% lactose free. So there still is a little bit of lactose for families that have a very genetic type of lactose intolerance. That may not be the best option, and so we switch them over to soy milk, which soy milk is completely lactose free.
Okay, well, what we're going to do is take a really quick break, and thank you for giving us that overview of sort of nutrition, especially with calcium, which is so important. And we're going to come back and look at diabetes.
Okay.
Okay?
Okay.
Please stay with us. We'll be right back.
And 36 homers. Swings at the first pitch and fouls it deep back into the stand.
Enfría alimentos crudos y preparados lo antes posible. Mantén tu familia a salvo. Visita foodsafety.gov/español.
Welcome back to continue our discussion talking about nutrition and health conditions. Joining me is Amy Pulse. She's a registered dietitian with Morton Comprehensive Health Services. Let's jump in. Now, you did a really good job sort of framing normal nutrition, especially with calcium and vitamin D and the milk controversy, because there's so many milks out there.
Right.
Let's look at diabetes. Now, tell me a little bit about diabetes. There are 2 different forms of it.
Sure.
And then we'll end up looking at the nutritional component.
There's actually three different forms.
Okay.
There's type 1, which we usually see in early childhood, and that's juvenile onset is what we typically call it. That's an autoimmune disease, and it attacks the pancreas so that your pancreas does not produce enough insulin or insulin at all. The next one is gestational, and that's a type of diabetes that we only see during pregnancy.
All right, forgot about that one.
Yeah. And then the third one is the most common, which is type 2 diabetes.
Okay.
And that really is both insulin resistance and a lack of enough of production of the insulin in the body.
Now, with children, we're seeing sort of a change. They normally were with the type 1.
Right.
But now we're seeing a shift to type 2.
Right.
What's causing that?
Obesity. Type 2 is generally associated with a high level of fat on the body. And that amount of body mass that you have, the more body mass you carry on your body, the more insulin you need to produce. And for patients with a family history of diabetes, a predisposition to where their pancreas doesn't produce enough insulin, and then they have a high amount of cells that need that insulin, they tend to go into diabetes earlier, the more they weigh.
Okay. Now, with weight, can you control your weight? Let's say you are obese and you're sort of showing some tendencies towards the diabetes. Let's say you've developed it. If you lose weight, people want to know, can you lose the diabetes?
Right. So for our patients that we've already identified that they have what we call prediabetes, we know that they don't produce enough insulin. They can match the amount of insulin that their body produces with their lifestyle. So what we tell them is to bring down their amount of carbohydrate that they eat, and we exercise. Exercise brings that blood sugar down. It burns it naturally so that your body doesn't have to produce enough or as much insulin to use the glucose. So there's a couple ways that we can bring that lifestyle in to match the amount of insulin that their body produces so we don't have to give extra insulin.
Okay. Now, when you say sort of lower the carbohydrate intake, again, we get confused. What is a carbohydrate? I mean, where is it?
Where do you find it?
Exactly, because some people say, I don't think I eat any.
The best way to find it is to look on a food label and look under total carbohydrate on your food label, and that will tell you if whatever you're eating has carbohydrate in them or in that food. The foods that typically have carbohydrate are your breads, so grains, pasta, rice, tortillas, crackers, your starchy vegetables, potatoes, corn, peas, beans and lentils, milk and yogurt, and fruits. And some non-starchy vegetables can have, depending on how much you eat, can have a significant amount of carbohydrate.
Okay.
So for our patients that are diagnosed with diabetes, we have them count those. And we put them on a meal plan where they're counting their carbohydrates. But for most people who want to prevent diabetes, or if they are pre-diabetic, we just need them to lose weight, exercise, choose low-fat foods, keep their diet within reason, not eat too much sugar.
Okay.
And
Now,
too many calories.
Let me ask you about this carbohydrate then. What is the normal amount that we should have? Is there a normal per day?
There is a normal.
And then how does that, or does it vary if you are diabetic and you're trying to change your eating patterns?
That's a great question. And I do see type 1 children. And the biggest difference between type 1 and type 2 is that our children that have diabetes, that have type 1, we want them to eat a diet that I would recommend anybody else to have. And that is 50% of their diet should come from carbohydrate. In our type 2s, we're telling them to decrease their calories, go down on those carbohydrates. So we are actually pushing them under that 50% marker oftentimes to get their carbohydrates down enough to match the insulin that their body is producing.
Okay. And when you say 50%, are you mean 50% of all of your caloric intake? So
Of your calorie
if you're
intake,
taking in
right.
1,000 calories a day, no more than 500 should
Right.
be carbohydrates.
Correct. And then we like to spread those out. So we know that people that maintain a healthy body weight, they eat 4 to 6 times per day. And so if we can spread
They
those,
do?
yes, they do.
That's what's recommended.
That's what's recommended.
Okay.
And that's actually part of what we call the National Weight Control Registry, where we look at thousands of people that have lost weight and kept it off for longer than 5 years. Those people have certain characteristics. They all eat breakfast. They eat 4 to 6 times per day, and they're aware of the total calories that they're eating, regardless of what diet they did to lose the weight. So we look at these characteristics and then we translate those into practice with our patients. And so we like to see patients eat breakfast. It sets the tone for the day of how many meals they should be eating. It tells you when you're hungry, when you should be eating. And then from there, we look at the type of carbohydrate we're encouraging, which would be whole grain, high fiber types of carbohydrates.
Okay.
And those keep you fuller longer, help you stay full between your meals so that you're eating about every 3 to 4 hours and not snacking every 1 or 2.
Okay.
So there's a little pattern here that we like to see. Not only does it have to do with how much carbohydrate we want you to eat throughout the day, but we want them in small bursts within your meals in a certain pattern where you're eating 3 or 4 times a day, or 3 or 4 meals per day, maybe 1 or 2 snacks, and those should be about every 3 to 4 hours.
Now, when we think about this, especially for diabetic, because it sounds like it's what we all should be doing.
Right.
When you say these 4 to 6 meals, I mean, okay, the typical person, we sort of think, okay, does that mean I have to have a protein, I have to have a vegetable, I've got to have a bread, I've got to have, is that every single meal, or are there variations that we can have?
There's a benefit to eating that way.
Okay.
So when you're eating your meals, we like to see 2 or 3 different types of foods.
Okay.
Okay, so sitting down eating a piece of bread, you're probably going to eat another piece of bread. That creates a little bit of overeating. If you eat a piece of bread with turkey, that slows that down, so you tend to stay fuller longer.
Okay.
That protein actually closes down the sphincter at the bottom of your stomach so it doesn't empty as fast. There's a benefit to eating well-balanced meals. And a well-balanced meal means that it has some type of complex carbohydrate, some type of protein, and we're hoping for fruits and vegetables.
Okay.
So those balanced meals tend to set you up for that healthy meal pattern that you're going to have throughout the day.
And again, even with diabetics as well as others, it's portion control, because with
Correct.
these 4 to 6
Yes.
meals a day,
Right.
if you're having these humongous meals, you're going to start picking up the weight, and especially with diabetic, you're going to do the opposite of what you're trying to achieve.
That's right. That's right. But I will tell you the biggest mistake I see eating-wise with my patients is they skip breakfast, they eat maybe a small lunch, and by the time they get home, they're starving. And they tend to graze throughout the evening. So they are eating 4 times a day. They're eating several times a day, sometimes 7 or 8 times a day. And so when it seems like that's a lot of times to eat, it's really not compared to what a lot of people are doing habitually.
Okay.
So we do try to match it to their schedule so that it's something that's easy to adopt. But eating breakfast is a great skill.
And does that help in terms of diabetic or even not with your blood sugar, maintaining a certain blood sugar so you're not getting all these spikes?
That's right. So we know that people that have great control of their eating pattern, their blood sugar tends to be under control, they have a healthy body weight, they also have control of the hormones that tell you when to burn fat and when not to burn fat. The couple that people are more familiar with are insulin and leptin, and those tell your body when to burn fat and when not to burn fat. If you're eating sugar throughout the day, your insulin is high. That high insulin will actually tell your body to not burn fat. So you're storing more calories.
Interesting.
Yeah.
Wow. So you can be doing things counterproductive, especially
Right.
as people think that maybe teens, that they're trying to control their weight so they don't eat and they don't do other kinds of things.
Right, exactly. And so you can really disrupt how your body burns and maintains its body weight. So the other interesting thing about insulin is that if you keep it high all the time, how it works, how your body recognizes it, turns off. And so really what another function of insulin is when you eat, your blood sugar should go up and your insulin should go up. Your insulin should tell your brain to stop eating. And so when that doesn't work, patients will come in and say, gosh, I'm hungry all the time. And that's probably true, that they're battling their hormones, that their hormones aren't working the way they should be.
Wow. Okay. When we come back, we're going to switch over and look at some cardiovascular disease and the nutritional approach.
Great.
Okay. Please stay with us. We'll be right back.
Cook foods to the right temperature using a food thermometer. 3,000 Americans will die from food poisoning this year. Keep your family safer. Check your steps at foodsafety.gov.
Welcome back. To complete our discussion talking about nutrition and health conditions, joining me is Amy Poles. She is a registered dietitian with Morton Comprehensive Health Services. I am so excited here about this information. Let's switch over to cardiovascular disease.
Okay.
And I want to focus, if I could, on blood pressure.
Okay.
Okay, because
Yes.
that's something that is really very rampant, prominent. Sometimes people don't even know they
Right.
have it.
Right.
Tell me a little bit about that, and then the nutritional focus.
Okay, so high blood pressure is generally diagnosed in the doctor's office. And so a lot of people will go for their annual exam and have no idea that they've been walking around with high blood pressure. The dangers of high blood pressure is that it can affect your organs. It can affect particularly your kidneys, can make them work not as good, can set you up for diseases such as heart disease, stroke. And so it's a good idea to get that under control. From my standpoint, when somebody comes in and they have high blood pressure, we always look at their body weight.
Okay.
The less body weight you have, the less your body has to pump. So kind of think about resistance. You know, the less fat and the less total body mass your heart has to pump against,
Okay.
then it doesn't have to pump nearly as hard. So we want to decrease that resistance that your body has to pump against, and we do that with exercise and with cutting calories.
Again, weight control.
Yeah.
Now, what about looking at the diet from the perspective of salts and fried foods? Tell me a little bit about that.
Okay. Totally different mechanisms. Sodium, we believe that there are people that are salt sensitive and some people that are not. But as a rule, we always encourage people to decrease their sodium. That benefits a whole host of other diseases as well. But decreasing sodium tends to also help you decrease things like eating out, fast food. And those are all good things from a dietitian standpoint that we like to cut out as well, especially if we are looking at controlling weight. So we like to see meals under 500 milligrams of sodium.
Wow.
Yeah.
That's not a lot.
It's not a lot. And it's, a lot of soups will put you way over in that.
Oh, yeah, and a lot of
category as well.
the frozen foods. If you go and look at the little
Yep.
sort of boxed meals,
Right.
and you look at it, sometimes
Right.
the sodium is like 1,000.
Right.
It's like off the charts.
So a good way to do it is to start weaning yourself down. So if you think you're eating about 1,000 milligrams of sodium each time you're eating, try to knock it down to 800 and then try to knock it down to 500. Eventually your body just gets used to it, and your taste buds get used to it to where you actually will not like salty foods.
Okay, now
if you get it out.
let me ask another thing about salt, because sometimes we think, okay, what about seasonal salt? I mean, are all salts the same as salt?
So,
or
right.
do those have an exemption?
Seasoned salt, sea salt, and table salt are all sodium. It's all going to have the same effect. And what it does is it tends to make you thirstier, tends to make you drink more, and then it increases your blood volume. That increases how much your vessels have to stretch, and that tends to promote more hypertension. So that's why salt is
Look,
not.
salt is salt.
Yeah, not a good idea.
Okay, what about powders? Because we'll see like garlic powder instead of garlic salt.
There are a lot of
are those
salt-
better options, or
There are a lot of salt alternatives, but you have to read those ingredient labels on the jars or on the shakers. Make sure you're reading those. A good one to head towards and read and look at is Mrs. Dash. They have lots of different options of how to season your foods without using sodium.
okay, because sometimes that can still be hidden in what we think is relatively salt-free.
Right, exactly.
Okay. What about fried foods? Does that really contribute to high blood pressure or versus baking?
Now that's a different mechanism. So fried foods tend to encourage more what we call metabolic syndrome. And so when you're eating a lot of fried foods, those foods tend to be fried in soy oil or vegetable oil. Vegetable oil has a very high smoke point, and that's why it's really good to fry in, where you can't fry really in olive oil. You can't get the oil hot
Right.
enough.
It's
It tends to smoke. But soy oil has a very high omega-6 fatty acid ratio. So what happens is people eat a lot of fried foods, their omega-6 fatty acids go up, and their omega-3s tend to be low, and that encourages inflammation. Inflammation can happen anywhere in your body. It can happen in your fat cells. That tends to make people have high triglycerides. Fats tend to circulate in their vascular system, get trapped in your liver, and we call that fatty liver. It also can just inflame the vascular tissue so that your tissue that carries your blood will attract more plaque and tend to narrow a little bit more. So it's a good idea not to eat fried foods. They're high in calories, but they're very inflammatory as well.
Okay, I don't think anybody realized that it was doing all that to your body.
Yes,
that is really the cycle.
That's right, and the vicious cycle of that is a high sugar, high fried food diet. The high sugar diet tends to make your insulin go high, and that tends to also encourage you to eat more than you normally would. You have more calories than you normally would circulate through your body. You can't store that in your fat cells because your fat cells don't work properly, and it increases that fat deposit throughout your body.
Now, if you eat these things periodically, and what I'm thinking about now, Amy, to tell you the truth, is like the fair. When you go to the fair, they've had all these fried corn and fried donuts and donut burgers and all of that. Are those things that you really should totally stay away from, or if you do it every blue moon, it could be okay?
Every blue moon probably would be okay. My rule of thumb with my patients is I say, if you're wondering how often I should do a treat, your treat should be like you can't remember the last time you had it kind of treat. Maybe that would be with pop. I haven't had a pop in a while. I can't remember the last time I've had a pop. That would tell you that you're probably doing those treats infrequently. If you can remember a history of how often you've been eating those, probably too often.
It's probably too frequent. Let me ask you one other quick question as we wrap up here. Looking at pops and sodas, if we're going to have those with whether you're diabetic, hypertensive, or just normal, should you have the diet sodas, or is it okay to have those that are not? Sugar contents, should we try to figure out salt, what?
Right, it is confusing. Absolutely no sugary pops is recommended. We don't like sugar in a pop. Diet is a better alternative, particularly for diabetics. And then you can also read for sodium on your soda. So one of the ones that we recommend is Diet Right. Comes in a silver can, and that's a low sodium diet pop.
Okay, and just really quickly, I only have about 5 seconds, juices. Should we monitor our juices as well? Because sometimes we think juice is fine. You can have as much as you want.
Right, that would be a better alternative. It's still sugar. So we're looking at 4 to 6 oranges and 4 ounces of juice. That's a lot of fruit. You can absolutely overdo fruit. It's still calories. So beyond a third to a half cup, you're overdoing it.
So look for that too. Thank you so much for joining me, Amy. Well, that's our show. For Health Alert, I'm Pam Butler. I'd love to hear your questions, suggestions, or comments. Please write me at Health Alert USA, P.O. Box 50913, Tulsa, Oklahoma 74150. Or if you're on the email trail, please email me at healthalertusa@gmail.com. And also visit me on YouTube at youtube.com/Health Alert USA. And remember, look at the labels, count the calories, count your intake, know what you're doing. And remember, if you burn more than you take in, you won't gain weight. Take care.